Hello, my name is Suzette Arrindell, and I would like to present to you with an idea for an evidence-based practice change that is not only cost-effective for the organization, but will also help to increase our patient satisfaction rates, and that's the use of a peanut birthing ball during labor. So our PICO question is, in laboring women, how does the use of a peanut ball, compared with not using a peanut ball, affect the length of first stage labor and the incidence of cesarean section rates? So our patient population are our laboring moms, specifically those who have an epidural. The intervention is the actual use of the peanut birthing ball during labor. The comparator is laboring moms who do not utilize a birthing peanut ball, and the hopeful outcome is a shorter duration of labor and a decrease in primary C-section rates. So our gap analysis, the reason why we're doing this, first stage of labor does encompass the onset of active labor to complete cervical dilation. And longer duration of labor has been associated with an increase the risk of needing a cesarean section. Repeat cesarean section deliveries are associated with the highest number of cesarean section deliveries. So if we can have that first-time mom or that mom have a successful vaginal delivery, that'll decrease that risk of needing a cesarean section. And because an epidural is very good with taking care of pain, but it can limit them in being able to move themselves around, repositioning themselves. So that is another problem that we see as well. The evidence that was found with regard to using the peanut birthing ball, it helped to open up the maternal pelvis, thereby aiding in rotation and descent of that fetal head, and thereby helping with cervical dilation. Like I said before, the moms that have received epidural anesthesia, they can be placed in a modified position. Since they can't move in their own, we're going to have to do that for them, and placing that birthing peanut ball in between their legs. And the use of the peanut ball has been shown to decrease the length of first and second stage labor, thereby decreasing the risk of needing a cesarean section delivery. So our SWOT analysis, the strength, weaknesses, opportunities, and threats to the study. The strengths are environment that encourages change. We do work in an environment where our managers, our directors are always looking for new, cost-effective ways of providing better patient care for our patients. The low cost of the birthing ball is only about $40 per ball, so and we will only need several of them, so the cost is extremely cost-effective. It's also non-invasive and non-pharmaceutical, so of course our doctors are very happy with that. Weaknesses, the patients may feel a little bit weird and maybe kind of an awkward position for them to be placed in, so they may not, we may not have quite as much buy-in as we would like to see. And like I said, those patients would need to be repositioned every 20 to 60 minutes. A nurse with a very heavy patient load may not be, I won't say willing, but it'll just be a little bit more challenging for them to do that. Opportunities, shorter labor hours. Of course, it's always a good opportunity for not only the patients, but also for the hospital, because we know we can have a fast turnaround for that next patient that comes in. Lower cesarean section rates. That's very important for our moms to decrease that risk of needing a cesarean section, which would also increase our patient satisfaction. The threats, like I said, the repositioning of that patient every 20 to 60 minutes is going to require that nurse to do that. And with that heavy patient load, she may not always be able to do that in the time frame that it should be done. And of course, we will need to have some physician buy-in for this as well. So our budget, we will probably need to purchase about 4 peanut balls, costing about $40 each. So the total cost of that will be $160. The materials, for posters, flyers, that's needed to not only needed for the collection tools, but also for viewing and for instruction will cost about $100. Staff budget, every nurse would need to have the opportunity to not only learn about it, but also to learn how to actually use the peanut ball, the correct ways of using the peanut ball. So it's going to take approximately an hour in order for us to do that. For 35 nurses, that's going to be about $1,400, basing this on an average hourly salary of $40 per nurse. So the total cost of the budget will be about $1,660. The project leader, I would be happy to perform in this function. I have done extensive research in this field. I not only come with 14 years of experience, but also have experience in working with other change projects, not only for some of our older coworkers, but a few of the change projects that I worked on with as well that have been successful. So I feel that I bring a little bit of experience and willingness to actually see this project through. So that's the reason why I feel that I would be the best to actually lead in this project. The positions that would be needed, of course, the project leader, the one that gets the ball rolling and stays until the ball actually stops rolling. Our senior managers, the one that actually do approve the budget for this. They're integral to this project. Our unit managers, the one that sees the operations of the unit on a daily basis, will need to be a part of this project as well. Of course, we can't have a project without a team of nurses there to actually implement the changes, to actually not only utilize the birthing ball, but also to record those results on a data collection tool. And then there are a few other experienced nurses that I have recognized that have had experience using a peanut ball before. So I feel that they would be a much needed addition, especially when we get the ball rolling with all the nurses and they can have just a little bit additional support. So that is my presentation. If you have any questions, please feel free to give me a call. Please feel free to email me. I'll be happy to not only provide you with the articles that I've researched on this project, but any other information that you have or any other question that you may have. Thank you very much, and thank you for listening.